Well, when it comes to the treatment, it depends on the case. What case? You cannot think of case to you. You have to see the kind of case, only you talk about the treatment. So generally, there is no specific method on how to handle this. Okay, we handle it according to the case that we see, depending on the case that we see. Okay.
So you use what untuk merawat mesin?
Like what I mentioned just now is not specifically what we use, because we have to look into the case and we suggest on what we should actually use on each case. Okay. There are cases in which we need to use machine. For example, if a patient may have infection, and the infection could cause something like swelling, and in a way you have passed inside. Ada nana lah dekat dia punya kaki, contoh lah. Kalau dia pergi tempat rawatan lain, mungkin diorang debride lah nak buang nana. Okay, kita ada metod kita yang kita boleh pakai mesin sudut nana. Okay, we don't debride. We use machine to drain the pus. Okay, and if it is an open ulcer like this, something like this. In the hospital you can see, right? It started like this, they debride, yeah? It goes up to this level. After that they have no option rather than to debride it furthermore. Okay. And this patient at this stage couldn't take it anymore. Okay. Happened to come to our clinic. Okay. When we started the treatment, we used machine in this kind of case. Okay. We use machine, this kind of way you see it. They debride this in order to drain the pus. And when we use the machine, we suck out pus about 18 liters. 18 liters, including with fuel. Okay. While we are doing the suction of the pus, we also can see like new tissue growing. See this new tissue growing. See, improving. This is about after 1 month of treatment. This is what we can see. This is the success we can make.
Machine itu is there any specific need?
That machine, this is a machine that we actually put head together. We may call it Warrison suction machine. Okay. Because we don't buy it actually. We fabricate the machine. It was our idea. There are a lot of more machines in the market, but they could be too expensive for a patient to afford. So that's why we decided to come up with our own machine, which is a little bit easier and more cheaper.
So one can use their own machine untuk every treatment.
You mean one case?
Yeah, for one case.
Unless if the case required machine. If it doesn't require machine, then we don't have to use machine.
So alternative treatment apa selain daripada machine?
Okay, apart from machine, what we do is, as you can see, our wound care center is just next to Clinic Sofia. Okay. What we do, if the case is like really infected cases, we will consult the Clinic Sofia to look into it. Okay. When we consult the Clinic Sofia to look into it, what they will do is they will fight the infection. Okay. For example, if a patient maybe in the hospital, if a specialist may suggest to amputate a patient's leg, one of the most reason is because of the infection. Okay. And we don't agree so much on that. Because why? If you are talking about amputation, amputate the patient's leg because of infection. But the infection is in the blood. Okay, the infection could be in the blood. So if you amputate the leg, it doesn't mean that the infection is already there in the body. You have to fight to kill the infection. Only you go for the healing of the wound. That is why we can have success in most of these cases.
You can find a solution to kill the infection.
Yeah, there are solutions which clinics of here combine with us and we have success in that.
So normally how long it takes patient untuk baik semua? Untuk certain case biasanya berapa bulan atau berapa?
Itu kena ikut kes lah. Kalau kes tu tak besar sangat, mungkin 2 bulan. Ada yang 3 bulan. Kalau teruk lah, boleh tolong sampai 8 bulan.
Paling cepat 2 bulan maksimum.
About 8 months.
Dari segi kos pula macam mana kos rawatan yang doktor?
Actually, when they come to us, we make it easier for the patient. If they were supposed to pay daily, it would be very expensive. It would be very expensive, okay? So what we do is, in a particular case, we will round it up. When we round it up, we bear the risk, okay? So we open it to be until fully healed. Okay, contoh, kalau I charge patient sekarang untuk 2 bulan, dia prolong sampai 3 bulan, kita tak ada further charge. Sebab kita sudah janji sampai baik. Kalau kes tu pun boleh sampai 6 bulan, 8 bulan yang saya cakap tadi tu, kos yang kita charge. So, to me, we are considered the cheapest. Because kalau patient pergi specialist center ke, mana-mana pun, diorang charge according to what they spend on you. So, if you are not healed pun, you still have to pay. But in our case, it's fine.
Bila dah habis sembuh baru bayar lah.
No. Bila masuk tu, you kena bayar apa yang kita charge. Okay, apa yang kita charge tu, contoh lah, kalau kita charge untuk 2 bulan, dia tak sembuh, dia prolong sampai 3 bulan, 4 bulan, 6 bulan. Kalau kita sudah charge you 3,000 sampai balik 3,000 tu 3,000, tak ada tambahan apa-apa.
Sampai baik lah. Dia tak ada ketetapan harga ke?
Kena tengok kes.
Anggaran mungkin doktor boleh bagi anggaran harga lah. Paling murah dan juga maksimum harga rawatan.
It's quite hard to say, because serious, it's quite hard to say because we need to see the case. Only we can.
Mungkin bagi pengalaman yang pesakit sendiri, minimum yang pernah dikenakan harga dan juga maksimum.
For example, if it is just a minor case, or if I get referred to,
dan kalau ada infection dan sebagainya baru combine dengan.
kalau ada infection baru kita combine.
Maksimum harga mungkin pernah kalau major case pernah
Yang ada dia susah nak cakap seriously sebab could be more. Yes. Could be more. It depends on the case.
or less than 10,000. Wow.
Look at this case. Because of this leg is infected, the tissues inside are already, in fact, they are really infected. So we need to open it up in order to suck with the machine. All this we need to open up. So after opening all this, it will take nothing less than a year to grow. Yes, because when you open it up, there will be no more tissue. Okay, so that will take about 1 year for it. Okay. So this case can go up to 19,000. If you analyze it properly, a normal dressing in an hospital, I mean in a normal clinic, will be about 30 ringgit minimum. Okay? So for you to run this leg for just dressing without even antibiotic, so you should times 30 times how many months? 1 year, 12 months. So we still consider the cheapest because we take it upon ourselves. We said, okay, this is about 19,000. So 19,000 sampai baik. Kalau 1 tahun tu dia tak baik, kita sambungkan.
Sampai baik.
Sampai baik. Yeah. Because we make it very easy for the patient. Kalau patient nak bayar hari-hari, mungkin ada 1 hari yang dia tinggal, dia tak nak pergi. Mungkin dia makan obat, dia tak nak makan. Bila dia bayar itu, dia punya kos rawatan itu, dia sudah tahu apa yang dia nak buat, apa yang doktor cakap, dia ikut. Apa yang wound care kita cakap, dia ikut. Kena makan obat, dia makan. Kena datang cuci kaki, hari-hari dia datang. Sebab dia tak nak duit dia hilang. Bukan duit dia tu yang hilang, kaki dia yang kita tengok. Kita tak nak dia hilang kaki.
So basically based on your experience, berarti patient yang atas ni memang dah very chronic.
Mostly 95 of all the patients that I see, 95% of all the patients that I see are all critical chronic ones. Banyak dia orang sudah sign dekat hospital untuk contoh esok nak masuk OT baru tahu ni. So bila dia orang tahu macam tu, saya juga kena pergi klinik, Warrison Wound Care Center. So consider chronic.
So kejayaan lah dari berapa pesakit ke semua pesakit berjaya diselamatkan daripada dipotong kaki dan alhamdulillah mungkin sihat boleh berjalan. Berapa ramai mungkin?
The joy yang we have is that all the patients that walk in to our center, at least 90 to 95 selamat. We can see, like today we have this makan-makan, we have this sugar like that. You can see with your eyes how happy they are. They come to us to become very sad. After 2 weeks in our center, they become very.
Sorry for asking about where you come from. So where you come from?
Where I come from, I am a Nigerian actually.
So how long have you been in Malaysia?
I've been in Malaysia for more than decades. For more than 1 decade. So that should be more than 10 years.
Yeah. Before this, doctor study di sini.
Okay, I studied overseas and I did short courses for the wound care overseas, Europe. Short courses also in the US. But what I am doing for the people today is my own formula, invented formula.
Maybe you can share what kind of formula?
Actually, this part of the question is something that is very sensitive. Yeah, because it could be too early for me to start going into this. This is one of my greatest secrets at the moment. But like what I said, I have a dream and my target is if I can actually heal more than what I expect, then I will tend to teach people about this.
So your target maybe next year, or next time?